Priscilla Natkunda, a resident of Kyenjojo district, lives with bipolar disorder.
My mother says it started way before 14 years, but the first time she really recognized it, I was 14 years old.
Whereas she recognized that she was suffering from a mental illness, Natkunda took a long time to accept treatment, and as such, she suffered serious consequences.
I got a severe depression. I broke down. I was very destructive. I spoiled a number of things in my house. I went around running around.
When she finally accepted to receive treatment in 2021, her life turned around.
Because I live normally with my children at home and my mother. I live normally at school. I teach. I'm an ICT and mathematics teacher. I teach normally. I live normally.
In the Rwenzori region, there are over 8,000 people suffering from different forms of mental illness.
One is alcohol and drug abuse related mental disorders. 30 patients out of 100 are suffering from epilepsy. Depression is also much.
There are several reasons for this rise in cases.
There has also been chronic illnesses such as HIV, and long-term illnesses or chronic illnesses such as the cancers, diabetes. Those that need long-term treatment as well, there is a way they disorient and also cause mental illness to some of these patients, so they need attention. But the new development now is the increasing levels of substance abuse, alcohol and substance abuse.
But whereas more and more people are now turning to hospitals for treatment as opposed to traditional options, the only place to seek this treatment from is Fort Portal Regional Referral Hospital. The large number of patients seeking treatment has in turn created several challenges for the hospital.
The common challenges, one is irregular supply of drugs, especially by national medical stores. Many times we run out of drugs, and indeed we are really challenged. Another challenge is understaffing. Institutions are there training mental health workers, but at the ground, when you come to our departments, we have, like here, much as we have our psychiatrist, but he is the director at the same time.
As such, the health officials are arguing that it's time government thinks of extending mental health services to lower health facilities like health center 3s and 4s.
Latest addition, I think I've seen the likes of Kayunga, Yumbe. So somehow some of these, as the population increases and given the burden of disease increasing, some, I'm sure, Ministry of Health will assess and also get to elevate some of the district hospitals to regional hospitals, or even creating mental health departments in some of these general hospitals.
While government considers this request, it also points out that priority should be given to eradicating factors contributing to the rise in mental illness among Ugandans.
To the people of Kyenjojo, that alcohol, drug abuse brings mental health isn't a problem. So therefore the message is clear, and we're asking our people to reduce. For drug abuse, that one we should stop completely. For alcohol, I do not know, but we should reduce.
Illness is not a one person's struggle, it's not a one person's problem, but a national problem. And for us as leaders, we want to echo that it is a problem, it is happening, it is in our communities, and our people are struggling with mental health.
This week, Uganda joined the rest of the world to commemorate the International Mental Health Day with the official event held at Kyenjojo Secondary School in Kyenjojo district.